In 1872, French neurologist Jean-Martin Charcot encountered a patient who would change medicine forever. A young woman arrived at the Salpêtrière hospital unable to walk, her legs completely paralyzed. Yet, every medical examination found nothing physically wrong. Her nervous system was intact, her muscles functional, her bones healthy. Traditional medicine declared her case impossible: paralysis without injury, disability without disease. But Charcot saw something his colleagues missed. Under hypnosis, the woman walked perfectly. The moment she returned to normal consciousness, the paralysis returned. Charcot realized he wasn't witnessing medical fraud or hysteria. He was observing the body speaking a language no one had learned to translate. The woman's legs weren't broken. They were broadcasting a message her conscious mind couldn't articulate: trauma, terror, unbearable psychological pain given physical form. Charcot had discovered what would become the foundation of psychosomatic medicine. The body doesn't just experience reality. It stores, processes, and sometimes screams what the psyche refuses to acknowledge. And when words fail, when consciousness can't contain the truth, the body becomes the messenger, delivering symptoms that are as real as any physical injury, but originate from depths most people never access. What Charcot didn't fully understand, and what modern neuroscience has only recently validated, is that this isn't rare pathology. It's how all humans function. Your body is constantly speaking a language older and more honest than words. Every tension headache after suppressing anger, every stomach pain before a difficult conversation, every mysterious illness that appears when life demands more than you consciously process. These aren't coincidences or weaknesses. They're your body's attempt to communicate what your mind won't acknowledge. Dr. Bessel van der Kolk's revolutionary research confirms it. The body keeps the score. Trauma, stress, repressed emotion, they don't disappear when ignored. They burrow into tissue, disrupt systems, create symptoms that medicine can measure but often can't explain. And here's the profound truth most people: your body isn't betraying you with these symptoms. It's trying to save you, forcing into consciousness what you've buried, demanding attention for what you've tried to ignore. But you have to learn the language. If you've ever experienced physical symptoms doctors can't explain, if chronic pain appeared without clear cause, if illness strikes precisely when stress peaks, if your body seems to rebel against you in ways that don't make medical sense, you're not imagining it, and you're not crazy. You're experiencing what depth psychology calls somatic communication, the body's attempt to speak truths your conscious mind refuses to hear. This isn't about mind over matter or positive thinking curing disease. It's about understanding that your body and psyche aren't separate entities. They're one integrated system where psychological states create physical realities and physical symptoms communicate psychological truths. Modern research validates this completely. Studies on psychosomatic disorders show that stress, trauma, and repressed emotion create measurable changes in immune function, inflammation markers, pain processing, and autonomic regulation. Your body's symptoms aren't metaphorical, they're neurologically, hormonally, and immunologically real. But their origins aren't where medicine typically looks. They emerge from the shadow territory between body and soul, where unspoken trauma becomes chronic pain, where suppressed rage manifests as autoimmune disease, where grief you won't acknowledge transforms into fatigue no rest can cure. Learning to decode these messages isn't optional wellness, it's survival. Because what you won't feel, you'll suffer, and what your mind won't process, your body will endure. The question is, are you ready to listen? Principle 1. The symptom as symbol. When pain carries meaning. Most people treat physical symptoms as problems to eliminate. Take medication, suppress the sensation, return to normal functioning. But depth psychology reveals something revolutionary. Many symptoms aren't malfunctions to fix, but messages to decode. Your chronic back pain might not be about posture. It's about carrying burdens you won't acknowledge. Your digestive issues might not be about diet. They're about situations you can't stomach. Your tension headaches might not be about hydration. They're about pressure you won't consciously process. This is the principle of symptom as symbol. The body's genius for creating physical metaphors when psychological expression is blocked. Dr. Peter Levine's somatic experiencing research demonstrates this brilliantly. He discovered that trauma survivors often develop symptoms in body locations related to their trauma. Soldiers with phantom limb pain where they were wounded, assault survivors with chronic pain in affected areas, even when tissue has healed. The body isn't confused, it's remembering, storing trauma in somatic form because consciousness couldn't integrate the experience. Studies on functional neurological disorders show that brain scans reveal altered neural pathways. The symptoms are real, but they're created by psychological processes, not tissue damage. Consider Rebecca, who developed severe arm pain with no medical cause. Every test returned normal. Physical therapy failed. Pain medication barely helped. But in therapy, she revealed something. Her father had controlled her through physical restraint when she was young, gripping her arm whenever she disobeyed. Her adult arm pain emerged precisely when her boss began micromanaging her work, creating the same dynamic of constrained autonomy. Her arm wasn't injured, it was speaking a truth she couldn't consciously admit. She was being controlled again, and she needed to break free. Once she recognized this, addressed the work situation, and processed childhood trauma, the pain diminished significantly. Your practice. When you experience persistent physical symptoms without clear cause, ask not just what's wrong, but what is this trying to tell me? Journal about when symptoms appear, what situations precede them, what emotions you're suppressing when they intensify. The body's language is metaphorical but consistent. Decode the symbolism, and you access messages your conscious mind needs to hear. But symbolic symptoms are just the beginning. The second principle reveals something more. Principle 2. The freeze response, when the body holds what the mind can't process. When trauma occurs, your nervous system has three options: fight, flight, or freeze. Fight and flight require action. But when action is impossible, childhood abuse where escape isn't an option, accidents happening too fast to respond, overwhelming situations where neither resistance nor flight will work, the nervous system freezes. And here's what most people don't know. That freeze doesn't just end when the danger passes. It stays, held in the body as muscular tension, restricted breathing, chronic pain, or mysterious illness. This is trauma's deepest secret. Unprocessed experiences don't fade, they fossilize in tissue. Dr. Stephen Porges' polyvagal theory explains the mechanism. When the nervous system enters freeze, it activates the dorsal vagal branch, a phylogenetically ancient shutdown response. Heart rate and blood pressure drop, digestion halts, consciousness narrows. It's biological wisdom. When survival requires invisibility, the body mimics death. But in modern humans, this freeze often persists chronically. Your body remains in partial shutdown years after the threat ended, creating fibromyalgia, chronic fatigue, autoimmune conditions, not because tissue is damaged, but because your nervous system never received the signal that safety returned. Michael, a veteran with unexplained chronic pain, embodied this perfectly. Medical evaluations found nothing wrong. But in somatic therapy, he discovered that his body was still holding the freeze response from an IED explosion 10 years prior. In that moment, he couldn't fight, the explosion was too fast, or flee, he was trapped in a vehicle. His nervous system froze, and it never fully came out of freeze. His chronic pain wasn't phantom, it was his body still locked in that moment, unable to complete the protective response it started. Through specific somatic techniques, titrated movement, completion of interrupted defensive responses, nervous system re-regulation, Michael's pain significantly reduced. The issue wasn't in his tissues, it was in his held trauma. The protocol. If you experience chronic pain or illness without clear cause, especially if it appeared after traumatic events, consider freeze release work. Practices like somatic experiencing, trauma-sensitive yoga, or polyvagal-informed therapy help your nervous system complete interrupted protective responses, releasing held trauma from tissue. This isn't alternative medicine. It's addressing the actual source of symptoms medicine often can't explain. Yet freeze is only one way the body speaks. The third principle reveals an even more hidden pattern. Principle 3, the organ dialect. Each body part has its own voice. Traditional Chinese medicine recognized this millennia ago. Different organs correspond to different emotional states. Western psychology dismissed this as superstition until recent psychoneuroimmunology research confirmed it's neurologically accurate. Your heart doesn't just pump blood, it processes grief and loss. Your gut doesn't just digest food, it processes anxiety and fear, hence gut feelings. Your lungs don't just breathe, they process sadness and the need to let go. Each organ system has specific psychological correlates, and when those emotions are chronically suppressed, those organs develop symptoms. Research on the brain-gut axis demonstrates this vividly. The enteric nervous system, your gut's independent nervous system, contains more neurons than your spinal cord and produces 95% of your body's serotonin. It's literally a second brain, processing emotional information independently. Studies show that chronic anxiety directly alters gut microbiome, triggers inflammatory bowel conditions, and creates symptoms medicine categorizes as IBS, but which are actually somatic anxiety manifestations. Your gut isn't randomly malfunctioning. It's communicating psychological states your conscious mind won't acknowledge. Dr. Gabor Maté's work on autoimmune diseases reveals similar patterns. He observed that conditions like rheumatoid arthritis, lupus, and MS often emerge in people with histories of chronic emotional self-suppression, particularly suppressed anger and boundary violations. The immune system, designed to distinguish self from not self, becomes confused when psychological boundaries are chronically VFAM. The body literally attacks itself, creating physical symptoms of the internal conflict between authentic self, which wants boundaries, and adapted self, which suppresses boundaries to maintain relationships. Lisa developed severe IBS that no medical treatment resolved. In-depth therapy, she revealed a pattern. Her symptoms intensified whenever she had to attend family gatherings where her boundaries were routinely violated, but where she felt unable to speak up. Her gut wasn't weak, it was screaming what her voice wouldn't say. This situation is intolerable. Once she learned to set boundaries verbally, her gut symptoms significantly improved. The organ had been speaking, she just hadn't been listening to its specific dialect. Your practice. Map your symptoms to psychological themes. Recurring throat issues? What aren't you saying? Chronic shoulder/neck tension? What burdens are you carrying? Heart palpitations? What grief or heartbreak are you suppressing? The body's organ language is consistent. Learn its vocabulary and you decode messages that transform not just symptoms but entire life patterns. But organ dialect is still surface. The fourth principle goes deeper. Principle 4, the anniversary phenomenon. When the body remembers what the mind forgot. One of depth psychology's most startling discoveries, the body tracks time more accurately than conscious memory. Patients develop mysterious symptoms on specific dates, the anniversary of a loved one's death, the time of year when trauma occurred, even dates matching events they don't consciously remember. This is the anniversary phenomenon, your body's implicit memory creating symptoms as temporal markers, reminding you of unprocessed experiences your conscious mind has buried. Neuroscience explains this through distinct memory systems. Explicit memory, conscious recall, is processed by the hippocampus and can be disrupted by trauma. But implicit memory, body-based emotional memory, is processed by the amygdala and basal ganglia and remains intact even when conscious memory fails. Your body literally remembers trauma your mind has forgotten, and it communicates through symptoms that emerge on psychologically significant dates. Dr. Kolk documents cases where children adopted in infancy with no conscious memory of birth families developed symptoms matching their biological mother's trauma anniversaries. One child inexplicably developed severe anxiety every September, the month his biological mother, whom he'd never met, had experienced a miscarriage years before his birth. The mechanism isn't mystical, it's epigenetic and implicit memory operating below conscious awareness. Maria experienced debilitating migraines every March for years. Medical workup found nothing, but in therapy, she realized March was when her father died 15 years earlier. She'd moved on consciously, rarely thought about him, but her body held the anniversary, creating symptoms that forced pause, reflection, grief expression she'd never allowed herself. Once she consciously grieved each March instead of powering through, the migraines lost their intensity. The body no longer needed to force what consciousness would permit. The protocol: if symptoms recur on specific dates or seasons, investigate what happened on those dates in your history. Check anniversaries of losses, traumas, significant life changes. Your body might be trying to process what your mind moved past too quickly. Honor these temporal markers with conscious attention, and often the body releases its need to speak through symptoms. The fifth principle reveals why this work is so difficult. Principle 5, the secondary gain trap, when illness becomes identity. Here's the uncomfortable truth. Sometimes symptoms persist not despite your desire to heal, but because they serve unconscious purposes. This is secondary gain, when illness provides benefits the conscious mind won't acknowledge. Permission to rest in a culture that glorifies productivity. Escape from intolerable situations. Care and attention otherwise unavailable, or even proof of how much you've suffered. The body's symptom becomes psychologically necessary, and healing would require losing something you unconsciously need. This doesn't mean symptoms are fake or willfully maintained. It means they've become integrated into psychological survival. Strategies. Dr. Viktor Frankl observed this in concentration camps. Some survivors developed psychosomatic illnesses immediately after liberation, as if the body could finally afford symptoms once the threat of death passed. The illness served a purpose: processing trauma, demanding the rest and care survival mode prohibited. Research on chronic pain shows this pattern clearly. Studies demonstrate that pain persists longer in patients with unresolved emotional conflicts, histories of childhood neglect, where illness was the only way to receive care, or life situations where disability provides escape from unbearable demands. This isn't malingering, it's the psyche using the only leverage it has to communicate needs the person can't advocate for directly. David's chronic back pain persisted for years despite treatment. In therapy, he slowly recognized an unconscious pattern. The pain intensified whenever work demands exceeded his capacity, providing legitimate reason to reduce hours. But he couldn't consciously admit he needed boundaries. His identity was built on being the strong one who handles everything. His back pain was the only acceptable way to say, "I need help." Once he learned to set boundaries verbally, to ask for support before reaching collapse, the pain's intensity decreased. It no longer needed to be his voice. The practice: examine your symptoms honestly. What do they allow you to do or not do? What needs do they communicate that you can't express directly? This isn't about blaming yourself. It's about recognizing that symptoms sometimes serve psychological purposes, and addressing those underlying needs is crucial for healing. Ask, if this symptom disappeared tomorrow, what would I lose? What would I have to face? The answers reveal the hidden functions keeping illness in place. The sixth principle explains why medical treatments often fail. Principle 6, the symptom substitution effect, why suppressing one symptom creates another. Western medicine excels at symptom suppression: medication for pain, surgery for structural issues, interventions targeting specific problems. But depth psychology reveals a troubling pattern. When you suppress a somatic symptom without addressing its psychological source, the body simply creates a different symptom. This is symptom substitution, the psyche's insistence on being heard, even if it must find new channels of communication. Freud observed this with his hysterical patients: cure the paralysis, and they develop blindness; resolve the blindness, and seizures emerge. He realized he wasn't dealing with distinct disorders, but with a single psychological conflict expressing through whichever somatic channel remained available. Modern research on functional neurological disorders confirms this. Patients who undergo intervention for one symptom frequently develop new, seemingly unrelated symptoms shortly after, not because treatment failed, but because the underlying psychological communication need wasn't addressed. Dr. John Sarno's work on chronic pain demonstrates this perfectly. He observed that patients successfully treated for back pain often developed other conditions: migraines, gastrointestinal issues, repetitive strain injuries. He concluded they all served the same function: distracting consciousness from intolerable psychological states, usually repressed rage. Cure one manifestation without addressing the rage, and the psyche creates another distraction. Only by addressing the underlying emotional conflict, the cycle of symptom substitution ended. Elena had her gallbladder removed for chronic pain. The surgery was successful, but within months she developed severe IBS. Treat the IBS, and she developed migraines. Her frustrated doctors couldn't understand why she kept getting sick. But a psychologist recognized the pattern. Each symptom emerged during periods of high family stress where Elena suppressed her needs to maintain peace. Her body was demanding attention for psychological states she wouldn't consciously address. Once she learned to voice needs directly, the symptom hopping stopped. The protocol: if you treat one symptom only to develop another, unrelated one shortly after, consider that you're witnessing substitution. Instead of chasing symptoms, ask what all of them might be communicating. What psychological state, unmet need, or suppressed could they all be expressing? Address that root, and the body often releases all manifestations simultaneously. The final principle is the most challenging and most liberating. Principle 7. The healing paradox. Sometimes the body must break to make you whole. Here's depth psychology's most controversial insight. Sometimes your body creates illness not as malfunction, but as intervention, forcing you to stop, to change, to confront what you've been avoiding. From this perspective, illness isn't just communication, but transformation catalyst. The body breaks what the psyche can't fix, creating crisis that demands the life changes consciousness resists. This is the healing paradox. Illness as the soul's last resort for saving you from a life that's destroying you. Carl Jung observed this in his own life. His famous confrontation with the unconscious in 1913 began with psychosomatic symptoms: heart palpitations, dizziness, near-fainting spells. Medical evaluation found nothing wrong, but Jung recognized his body was forcing what his ego resisted: descent into the unconscious, confrontation with the shadow, psychological transformation he intellectually understood but experientially avoided. The symptoms didn't stop until he surrendered to the journey they demanded. Research on illness and life transitions shows correlation. Major physical breakdowns often precede or coincide with necessary but resisted life changes, leaving toxic relationships, changing careers, addressing addictions, confronting trauma. It's as if the body, recognizing the psyche's paralysis, intervenes with the only leverage strong enough to force change: physical incapacitation. The illness isn't punishment, it's rescue. Thomas developed severe chronic fatigue after years in a high-stress job he hated but felt unable to leave. Financial obligations, family expectations, identity investment. Every treatment failed. But in depth therapy, he recognized a pattern. The fatigue made continuing the job impossible, forcing the career change he'd been too afraid to choose consciously. His body had intervened when his will couldn't. Once he accepted this and made the change willingly, his energy gradually returned. The fatigue had served its purpose. saving him from slow death in a life that was killing him. The practice. If you face serious or chronic illness, alongside medical treatment, ask the radical question: what is this illness protecting me from? What life change is it forcing? What would I have to confront if I were healthy? This isn't about blaming yourself for illness. It's about recognizing that sometimes the body's wisdom operates at levels consciousness can't access. Honor the intervention. Make the changes it demands. Often, healing follows surrender. Integration, the somatic listening protocol. You now understand the 7 principles, but knowledge without practice changes nothing. The somatic listening protocol provides systematic methods for decoding your body's messages and addressing the psychological sources of physical symptoms. Week 1 to 2, symptom mapping. Create a detailed symptom journal. Track not just what hurts, but when, in what contexts, after which emotional experiences. Notice patterns, symptoms that intensify with specific people, situations, or anniversary dates. You're building a translation dictionary between your body's language and conscious understanding. Week 1 to 4, symbolic decoding. For each major symptom, ask, if this were a metaphor, what would it mean? Back pain equals carrying too much? Throat issues, unspoken truths? Gut pain, situations you can't stomach? Write the symbolic interpretations. Often, the metaphor reveals the message. Week 5 to 6, emotional archaeology. For symptoms without clear physical cause, excavate emotional history. When did it start? What was happening in your life then? What feelings were you suppressing? This isn't about blaming past events. It's about recognizing psychological wounds that need conscious processing. Week 7 to 8, body dialogue practice. Develop direct communication with symptomatic body parts. In meditation or journaling, ask the pain/symptom, what are you trying to tell me? What do you need? What would make you feel safe releasing? This sounds strange, but activates implicit knowing your conscious mind can't access directly. Week 9 to 12, integration action. Based on insights from previous weeks, take concrete action, set boundaries the symptom has been demanding, process grief you've been suppressing, change life situations your body has been protesting, complete trauma processing your nervous system needs. Real healing requires behavioral change, not just understanding. The ethical framework. This work doesn't replace medical care, it complements it. Always seek appropriate medical evaluation for symptoms, but recognize that medicine treats tissue, depth psychology addresses meaning. Both are necessary. Also, don't use this knowledge to bypass genuine emotion or create spiritual bypass. The goal isn't transcending the body, it's finally listening to it. The promise. People who learn somatic listening don't just reduce symptoms, they develop entirely different relationships with their bodies. Physical sensations become information rather than threats. Illness becomes communication rather than punishment. And the body transforms from enemy to ally, from problem to guide, from source of suffering to source of profound wisdom about what your soul needs to thrive. Return to 1872, to Charcot and the woman who couldn't walk. What he discovered that day would take over a century to fully understand. The body's symptoms aren't malfunctions to suppress, but messages to decode. That woman's paralysis was her psyche's last desperate attempt to communicate trauma her conscious mind couldn't process. When Charcot finally learned to listen, when he addressed not just her legs but her psychological wounds, she walked again. Not because he fixed her body, but because he heard what it was trying to say. You now possess what most people never learn. The body speaks a language more ancient and truthful than words. Your symptoms aren't random or meaningless. They're precise communications from depths you've been taught to ignore. Every pain, every mysterious illness, every physical manifestation without clear medical cause is your soul's attempt to speak through the only channel available when consciousness is blocked. But here's the final truth. The body will be heard. You can listen willingly, decoding symptoms early and addressing what they reveal. Or you can resist, and the body will speak louder. Chronic conditions, severe illness, breakdowns that force what gentle whispers couldn't. The choice isn't whether to listen. It's whether you'll hear while whispers still suffice, or wait until the body must scream. In our next exploration, we'll reveal the advanced practices, how to identify which psychological wounds create which physical symptoms, the specific somatic release techniques for different trauma types, and the hidden eighth principle that transforms suffering into sacred communication. That's mastery. But it begins here, with recognition, with finally understanding when the body goes silent, it's not because there's nothing to say. It's because the soul is speaking in a language you haven't yet learned to hear. The body is speaking. The symptoms are messages. The question is, are you ready to listen?